Hello and welcome back to my channel. So before starting the vlog for today, I'd like to request those who are new to my channel and also those who have not subscribed to my channel yet, please do subscribe it and also press the bell icon so that you get notified every time I come up with a new video. So today I'll be discussing with you all about a disease which is called as measles, जिसको आप आम भाषा में खसरा कहते हैं. और उसको शुरू करने से पहले एक बार मैं आप लोगों से ये डिस्कस ज़रूर करूँगी दैट येस आई स्टार्टेड दीज व्लॉग्स विद द डिसीजेस ओनली, बट एज यू ऑल हैव रिक्वेस्टेड मी टू मेक वीडियो फॉर सीरीज़ ऑल्सो. सो दोनों ही चीज़ मैं साइमल्टेनियसली करूँगी, मीन्स नीट पे भी मैं व्लॉग्स अपलोड करूँगी बीच बीच में और साथ में डिसीज़ेस के बारे में भी डिस्कस करेंगे. सो आज मैं आपके साथ डिस्कस करूँगी अबाउट द मिजल्स. ओके, सो बेसिकली ये जो वायरस होता है ये पैरामायोक्सोविरिडे फैमिली का एक वायरस है जो कि मिजल्स कॉज करता है, विच इज़ कॉल्ड एज रूबियोला. एंड ये एक आरएस होता है विद वन स्टीरियोटाइप. एंड बेसिकली मोड ऑफ ट्रांसमिशन कैन बी द ड्रॉपलेट, एयर ड्रॉपलेट्स ऑफ द पेशेंट विच इज़ सफरिंग फ्रॉम इट, एंड द सोर्स itself is a patient. So period of communication, we can say that you may have rashes if you come in contact with a patient suffering from it before 4 days and after. So what are the host factors for it? Basically the adults and the infants of about 6 months to 2 to 5 years can be considered in it. And if environmental, if any, can be in winter season or spring season. So for studying the sign and symptoms, we will divide it into 3 parts, that are the prodromal phase, the eruptive phase and the post-measles stage. So for the prodromal phase, we can consider it FCC. F stands for fever, C stands for cough, and C again stands for coryza. So we can remember it by FCC. And for the newborn ones, we can say that on day 1, there can be a refusal of the feed by the baby and fever, conjunctivitis and the stuffy nose. And on day 2, there will be appearance of a whitish discoloration or spot which is called a scopic spot on the first and the second upper molar teeth of that baby or the patient. So on the 3rd day, there will be appearance of maculopapular rashes, which is basically reddish rashes which may be present if you are suffering from measles. So basically what happens, they will appear on your in a that is called as craniocaudal. Means firstly they will appear back side of your ear, and then on the face, then on the upper limb, means this hands, and then on the chest, then abdomen, and then finally on the lower limb. So this whole sequence is called as craniocaudal, and same way this will disappear also, okay, in the same sequence. So this is called the craniocaudal appearance of the maculopapular rashes, and this will appear on the 3rd day. So for the eruptive phase, there will be appearance of browny scaly rashes. So what is the post measles stage? Basically इसमें हमें complications देखने को मिल सकते हैं पेशेंट के अंदर. उसके बाद जो पेशेंट होता है he or she may suffer from diarrhea. What is diarrhea? Diarrhea is 2 to 3 episodes of loose watery stool. The patient may suffer from pneumonia. Okay, means the fluid, or we can say that the collection of fluid alveoli is called as pneumonia. मतलब कि पानी भर जाता है एल्वोलाई जो कि लंग्स में होती है उसमें, ठीक है. एंड देयर कैन बी माल नरिशमेंट ऑफ वाइटामिन ए, मीन्स देयर कैन बी deficiency of vitamin A, and there can be acute sclerosing panencephalitis in that patient. The patient may suffer from acute meningitis. Okay, what is meningitis? The inflammation of the that covering of the brain, that is called as meningitis. Okay, so also one more thing, that in the post-measles stage, you will also see the patient suffering from otitis media. What is otitis media? Basically, it is an infection of the middle ear. Okay, so that is also seen. Also for the treatment part, basically if that patient is an infant of about 6 months, we used to give that patient about a dose of 50,000 international unit of vitamin A. And if the patient is from 6 months to 12 years, we used to give that patient 1 lakh IU, means international unit. And if that patient is more than 12 months, we used to give that patient 2 lakh international units of a dose of vitamin A. And if that patient is having the if that patient is having the post-measles complications like pneumonia and otitis media, we need to give that patient the antibiotics the required amount, and also we should give that patient a good proteinaceous diet as well. So for the prevention, the person can take, or we can say that infants को हम लोग vaccinate कर सकते हैं before only. So we can give the vaccination for the measles, that is MMR, which is the measles, mumps and rubella. At 9 months of age, we can give the first dose, and the second dose, which is the booster dose, can be given at 16 to 24 months of the age. And supposedly, if someone is being affected with the virus, so the precautions which we can take is that we can isolate that patient from everyone else, and we can maintain the hydration of the patient by giving the required amount of ORS. So that could be the prevention. So now at last I will discuss about the diagnosis. Basically, diagnosis can be made by seeing the coptic spot and the maculopapular rashes, which I have earlier told you in while I was discussing about the clinical phase, that is the sign and symptoms. Basically, what happens in the prodromal phase, on the day 2nd, we can see the coptic spot. Basically, ये एक sand like whitish spot होता है, which appears on your first and the second molar teeth, upper molar teeth, and on that basis you can make the diagnosis. Also on the third, the maculopapular rashes, which was reddish rashes, which was appearing on your body in a craniocaudal way, means firstly the ear, and that I've told you earlier in my vlog. So in that way you can make the diagnosis. So that is it for the vlog. Hope you guys liked it, and if you did, please don't forget to like, share and comment, and also please subscribe my channel and press the bell icon. And if you have any suggestion regarding my vlogs, that also you can comment in the comment section. And if you want me to make videos on the topic which you want, any of them, please do tell me that also. And till then, take care.